contained medical incident or a warning sign for a future global outbreak? We're going to be decoding all of that, but before that, the top headlines we're tracking for you. The Suvendu era begins. Suvendu Adhikari to be the next Chief Minister of West Bengal, swearing-in ceremony at 11 a.m. tomorrow on the 9th of May. Wowchan News 9 to bring you all the latest. Meanwhile, in the state of Tamil Nadu, actor-turned-politician and TVK chief Vijay meets the governor Rajendra Vishwanath Arlikar and stakes claim to form the government as the TVK secures support from the CPI, CPM and the VCK. DMK Member of Parliament Kanimori writes to the Lok Sabha Speaker requesting to be seated away from the Congress MPs in Lok Sabha after the Congress party walked out of that alliance with the DMK in Tamil Nadu. Nida Khan, the prime accused in the TCS corporate conversion case, sent to police custody after her arrest until the 11th of May. Well, the world is once again watching a virus outbreak unfold aboard a ship at sea. And for many, it's triggering uncomfortable memories, and rightly so, about the COVID horror and nightmares that we all had. A luxury expedition in the Atlantic has turned into a medical emergency. What was meant to be a high-end bird-watching tour through South America has ended in tragedy, with 3 passengers dead after getting infected with Hantavirus and a vessel full of people currently stranded. The ship is the MV Hondius, a Dutch expedition vessel, and it is currently making its way to the Canary Islands in Spain under a cloud of international concern. Well, why? Because the ship currently has 149 people stranded, including 2 Indian nationals. The condition of the 2 Indians are still not clear. The vessel is expected to reach Tenerife in the next 3 to 4 days. According to the operators, all infected passengers have already been evacuated. There are no symptomatic cases left on board at the moment. Doctors are present on the ship and medical teams are closely monitoring everyone. The World Health Organization and Dutch authorities are involved in the response. Plans for quarantine and screening are already underway once the ship reaches the port. The outbreak is linked to a bird-watching tour that many passengers took in Chile, Argentina, Uruguay, all during the South American leg of the trip. The first passenger showed symptoms on the 6th of April, later succumbed to those symptoms. Reports suggest there was a delay in diagnosing Hantavirus in the first place. Passengers on board come from 23 different countries, including the United Kingdom, the United States, Germany, Spain, many others. So far, 8 cases of Hantavirus have been confirmed. Health officials say more cases could still appear because the virus can take up to 6 weeks to show its first symptoms. The World Health Organization has made it clear that this is not a COVID-like situation. They say the public health risk remains low. Alerts have been sent to 12 countries whose citizens had already left the ship earlier. But the primary concern is the Andes strain of this virus, because unlike most versions of the orthohantavirus, which only spreads through contact with rodent droppings or saliva, this specific Andes strain can spread between humans through close contact. And that's the alarming point, because the incubation period for Hantavirus can last up to 6 weeks. Health officials warn that more cases could emerge even after the ship docks. Currently, there is no approved vaccine for Hantavirus as well in most of the countries. And though research is ongoing in several nations, including here back at home, authorities are now focused on safe docking, a full medical screening, and then, of course, contact tracing that's going to begin.
So far, 8 cases have been reported, including 3 deaths. In line with the framework of international health regulations, the response so far has involved close coordination between national authorities and bilateral partners. A WHO expert boarded the ship in Cabo Verde and has been joined by 2 doctors from the Netherlands and an expert from the European Center for Disease Prevention and Control. They will stay aboard the ship until it reaches its next destination in the Canary Islands. They are conducting medical assessment of everyone on board and gathering information to assess the risk of infection. Yesterday, the UN team supported authorities in Cabo Verde with medical evacuation of 3 patients to the Netherlands for specialized treatment following the multinational operation coordinated by the Dutch, Cabo Verde, and ourselves. The resident coordinator's office in Cabo Verde also continues to support national authorities on crisis communications and public outreach in close coordination with WHO.
Well, I think you're going to be told everything, and you already have. It's very much, we hope, under control. It was the ship, and I think we're going to make a full report about it tomorrow. We have a lot of people, a lot of great people studying it. It should be fine. We hope.
Team set of doctors with us on the broadcast. The big questions that we are asking on the show tonight. Given that the WHO has confirmed that the Andes strain can spread between people, are the on-board monitoring and evacuation of symptomatic cases enough to prevent a second wave of infections during the 4-day transit to Tenerife? And with an incubation period of up to 42 days, how will international health authorities track the passengers from 23 different countries once they disembark? And is a standard port quarantine sufficient to catch late developing cases? The WHO insists this isn't another COVID era strain, but we heard the same reassurances back in 2020. Is this a scientific fact, or are we witnessing the same dangerous downplaying of a virus that we know can jump from human to human? With us on the broadcast, Dr. Puneet Misra, Professor of Community Medicine, All India Institute of Medical Sciences. Many thanks for taking out the time. Dr. Ishwar Gilada, Secretary General, People's Health Organization, somebody who's an expert when it comes to infectious diseases. And Dr. Sulfi Nohu, National Coordinator, IMA, and former State President, IMA Keralam, with us on the broadcast. Dr. Gilada, let's get the snowball rolling with you. The WHO says the public health risk at this point in time remains low. But the phrase human-to-human transmission, it has that horrific nostalgia that's attached to it. And understandably, it has alarmed people as well. How worried should the average viewer actually be? Help us understand the Andes strain and the symptoms that people aren't aware of at this point in time.
Thank you very much for having me on the show. WHO is right that though there is a risk, it is not going to be like a COVID. However, whenever any small infection comes, it always has a potential to become big. When we talk about the Andes strain, it has a potential to cause respiratory syndrome. It's called Hantavirus respiratory syndrome. And Hantavirus respiratory syndrome is much more severe than the other syndrome, which is called HFRS, that is hemorrhagic fever renal syndrome, that is usually caused by Hantan strain or Seoul strain or Dobrava strain. So when you are likely to get an infection, which and subsequent condition, which can be in 40% cases fatal, 40% death rate.
Wow.
Therefore, and this is very important here. Secondly, most of the infections, they end up from rat or rodents to human being. After the human being to human being transmission, only Andes strain is known for that. So Andes is notorious for two things. One is giving a very severe infection or severe disease, and secondly, human to human transmission. Now, when there is a human to human transmission possible, then it will spill over out of the ship. Already a lot of people have disembarked. This is like a city bus, which is people are embarking and disembarking. It is not a ship where they boarded at one place and they will go back to the same place.
Even as the WHO downplays all of that, Dr. Gilata, how dangerous is this? All those people, those who have disembarked, it takes about 42 days for it to, incubate. How dangerous is all of this in terms of, developing this new hantavirus outbreak?
So, because the incubation period is long, during this incubation period, the person can infect other people and without knowing. Sometimes they may not also know that they have come from this kind of contact. For example, those people who would disembark a month before, they could have been also infecting somebody. So it can cause some infection. However, because it is not droplet infection, it is not a kind of a COVID where one person can infect hundreds of people. It is not possible here. It is the reinfection factor is much less as compared to COVID. That's the reason that it cannot become COVID, but we should be worried because of two things. Number one, there is no cure. Number two, there is no vaccine.
All right, all right. So we should be worried. Dr. Sulfi, what's your opinion about this? Even as the WHO downplays all of this, are you okay with the kind of level of alarm that we've been seeing over the headlines, over how people are talking about it, given the last 3-4 days? Are we overreacting to all of this because of the COVID-19 trauma, or are we underestimating how quickly the next outbreak can actually spread? After COVID, there was public anxiety around viruses. It still remains. It's extremely high. How will you as a doctor balance that awareness without triggering unnecessary panic? If I could give the baton to you.
Yeah, I think it's significant that we always keep a watch on any outbreak. That is actually good. But at this moment, for this hantavirus infection, I think actually that the history of this disease for the last 30 years plus is which shows that it is a very, very self-limiting. If I can say that, if it may be a self-limiting illness, and maybe will not cause rapid spread like COVID-19 or any other illness, maybe some influenza infection and all. But it is never going to be like a COVID infection, and the fatality rate is also not unless and until it is the renal and the pulmonary and the cardiovascular system is affected, which will not be very, very serious. So I think we can justify in the approach of the World Health Organization, which says that at the moment there is nothing to worry, and the long incubation period. But
Dr. Sulfi, last time back in 2020, that's exactly what the WHO had said initially as well. There's nothing to worry about, and the mutation aspect and factor. I'm going to come across to the other doctors as well. But what, according to you, is the mutational, burden and overload here? Because we had the Omicron variant, we had the Delta variant of COVID-19, all of those different variants that kept on changing and kept on mutating. Is that the similar scenario here?
No, but fortunately, see, regarding the COVID-19, we were not at all aware about that virus. The mutation part we were observing, and we could find out a lot of mutations. But fortunately, this virus is known to the world for maybe many decades, and the possibility of mutation is still there, but I think it may not be that significant if you look into the history of this virus.
I'm going to come across to Dr. Puneet Misra. Dr. Misra, just like Dr. Sulfi pointed out, back with SARS-CoV, it was very novel. We did not know about it. The first patient in this particular case also reportedly died before hantavirus was even suspected or diagnosed. Rare infections, are they still too difficult to diagnose quickly, even in this hyper-connected world that we're living in such an advanced medical setup? It is still difficult when it comes to diagnosing these rare infections.
See, many of the viral diseases, they have the same kind of, symptoms. So just by looking at the symptoms, sometimes it's very difficult, because when a patient comes, you think of the common diseases and common symptoms and the common test which you do. But the thing here is, in the ship, any ship, the facilities, they are limited for the testing and the treatment. We have certain lab tests available for hantavirus, which we don't do in the regular practice. The issue here is when most of the people, they are worried about the pandemic potential of this virus, and they compare it with the COVID, because the COVID was the recent pandemic which everybody has experienced, and experience was difficult for people to realize. So here it is, as an epidemiologist, what I can say here is that it has very low potential for that. So as from the public health point of view, there is a very low threat. There should not be any cause for panic.
Okay.
We should keep an eye, we should keep an watch on these people, where they are going, and all the public health authorities in most of the countries, they have a system how to trace these people, what to do next, so that we can limit infection. Now we know there are people from different countries in that ship, and they have come in contact with this virus, and this variant of virus can spread human to human as well.
Yeah.
So even if they disembark the ship, now we know about that this has happened in the ship. I'm quite sure that public health officials from different countries, they will keep track of these people. So there's a very low possibility of getting people infected. The other thing is, even if infection is there, how rapidly it is spread, that is an important factor. Like in COVID, we have seen that it was through respiratory route, and people, they were getting infected. The other factor which you might have heard, or not, that how many people can get infected from one case. So all those factors we keep in mind.
Yeah.
For this virus, this is here for decades. From 50s, we know about this virus. There are cases in different countries, including US. Even the cases have been reported from India earlier. That's in the literature. And there is a study which has found that even in the healthy blood donors, there were around 6% people in a small town, I mean, where it was done in South India, they have found the prevalence. So antibodies are there in 6% of people. This is well-known virus for long. And the potential of spreading too fast like COVID is very unlikely.
Okay.
So I don't think there's any cause for concern from public health protection.
That's the silver lining here. We know about this. It's there in the literature. Literature might not be as robust, but there is enough data on this particular disease. Dr. Gilada, let's talk about these floating petri dishes. This happened on a cruise ships, and cruise ships have repeatedly become centers of infectious outbreaks. What makes these floating petri dishes medically so vulnerable despite our modern protocols that are in place? And whilst you're at it, there is currently no widely approved vaccine for hantavirus, just like you mentioned in your opening submission. In outbreaks just like these one, early detection is going to become the biggest weapon now, isn't it?
See, basically, when you talk about a ship,
Yeah.
and in this situation, ship is an isolation center or isolation hospital. So there are advantages and disadvantages. One advantage is that the infection is contained in the ship, and now onwards, those who are disembarking, embarking, anybody going in and out, they will be under vigilance and they will be checked. Secondly, there is a very simple principle in medicine. Common things are thought of commonly, rare things are thought of rarely. Currently, in ship, they will always think of hantavirus. Whereas if you talk about Mumbai, Delhi, or anywhere else, if such people come with fever, cough, etc., we'll think of dengue, we'll think of malaria, we think of other flu, we'll not think of hanta. So it will all depend on where the patient is. And thirdly, you are answering your previous question, giving you a very simple analogy. Anybody who becomes a doctor or engineer or professional, they come from 10 plus 2. But everybody who is 10 plus 2 doesn't become a doctor, engineer, or a professional. So that means for 10 plus 2, we need to keep on working so that we always feel that that person should go to professional course. Same thing, that we think of the worst and do our best. We think that worst thing can happen with hantavirus. But as a scientist, as a medical community, as a WHO, what best we can do? There is no cause of concern for common man. And that's what is our request from all three of us. That currently, yes, this is a cause of concern for scientific community, for public health community, for governments. But it's no cause of concern for common man. Because currently what happens is any news comes in media, in newspapers, people start calling. We have seen rats in our home. Is hantavirus in our rats? So basically when common things are there like rat or you're dusting or you're using broom and all these things are spoken of, people will consider that they're at risk.
Okay, all right. Dr. Sulfi, when it comes to becoming a benchmark of how to tackle COVID-19, I think Kerala was a state that really set the standard for the entire country to follow. India's healthcare system, let's throw some light on that, on our preparedness. It has evolved enormously since the COVID-19 pandemic outbreak. If a suspected hantavirus case emerged, let's say tomorrow, are we realistically better prepared now in terms of testing capability, our surveillance at these ports and airports, isolation systems, the genomic tracking? Where do we stand right now today? You're confident and comfortable on that front?
You're asking me.
Yeah.
Actually, I think in a way, that's actually maybe that question may not, that situation may not arise as a, that is what I think. It will not be a big outbreak in India or any other country. But having said that, I will say that if you look at any other scenario, maybe not this hantavirus or maybe any other fresh infection, we are better prepared after this COVID experience. I will say that the entire world is better prepared. Many countries are better prepared. Kerala is better prepared. India is better prepared because we have the experience, our scientific community as well as the infrastructure and the supporting staff. Everyone is better prepared than the COVID era. So I think at the moment there is nothing to worry. If at all there is a big
But then, Dr. Sulfi, the WHO says more cases may still emerge. because the incubation period can stretch up to 6 weeks, does that make containment more difficult across the world, not just about India?
No, yeah, it's 6 weeks incubation period is definitely a challenge because a lot of patients they might have got that infection and that will come out. But then I think it's a close group at the moment. It's a close group and it will not spread. Man-to-man spread is very rare. Man-to-man spread is in this hantavirus is very, very rare. And so I think it will not spread like that. If only thing is we'll have to observe all those patients, all those people for the next 6 weeks, and maybe the incubation period is over, or maybe the surveillance period is over. We'll have to look at watch those patients very meticulously. That is all what we need to do. There is nothing to that. The bottom line is it's not going to be a public health problem in the entire world. There is no question of panic at the moment.
No reason to panic. It's not going to be a global outbreak or a problem of that sort. But one thing that does come to light, and Dr. Misra, throw some light on that. This outbreak, it reportedly began after exposure during a bird watching trip in the South American leg of this jaunt. Climate change and expanding human interaction with wildlife increasing zoonotic risks globally. Is that something that we do need to take a look at? Last time around, it was the bat in Wuhan, as far as I remember.
Yeah, very good question. Zoonotic diseases, they are on the rise, and mainly because of the climate change, because of the environment and the interaction, like in the forested area, more and more forests they are being cut, and the interaction between humans and animals, and many animals, they don't have place to live in the forest. They're coming towards the cities and human habitations. So all these factors, they are playing a role for zoonotic diseases, and they are on the rise. But we need to be cautious. I mean, we can't stop the change which is happening. So the only thing is we should be watchful, we should be careful, whether it is hantavirus or any other virus which comes in the future. So, and COVID has taught us about the public health systems, which are robust in most of the countries. Even if you see the response at the time of COVID, when that was an unknown virus, and how the health community all across the world, they have tackled that thing, and then ultimately vaccine has been developed, and that has been controlled. So I think these challenges will occur, but public health system globally, that is in much better shape to take care of these things, and the common public should not be worried about it. They should not be panic about it. And for hantavirus, I can say for sure, there is no threat. There's no threat like a pandemic potential which we had in the COVID. So there is nothing to be panic. Be aware. Government is doing everything which is possible, and it's 0% chances of getting a pandemic or having something which is...
A summary of that answer would be, don't even bother about this one. It's of no concern, essentially. Dr. Gilada, even as Dr. Misra says that, let's not be bothered about it, let's still educate the viewers here. Dr. Misra said, we should be, helping the viewers out. The government is doing its job. Let's help the media do their job. And I need your help on that front. Early hantavirus symptoms resemble common flu or viral fever, something that Dr. Misra also pointed out earlier, that, the symptoms might be overlapping. What are the warning signs that people absolutely should not ignore, specifically after international travel and especially on these cruise ships?
Answering the pointed question, whenever there is something called travel medicine, which is not well-developed branch in India. So travel-related issues are there, and travel, whether they went into forest, whether they went into wildlife, they went for bird watching, so they are all at risk of those things. Now, what is happening generally, we human beings, for our own selfish motto, we try to intrude into the atmosphere of other things. And there we are least bothered that we are disturbing their atmosphere. We are going into their ecosystem. They are going to bother us. And that is happening. Ecological balance, we are eating any kind of meat and fish and kind of insects. You go to China, they eat everything. So if this is the situation of human being for their own selfish motto, how can we blame virus?
Yeah.
Now, and secondly, we have for bacteria we have antibacterial. For fungus we have antifungal. For parasitic we have antiparasitic. For viruses we don't have perfect antivirals. So this is era of viruses, and particularly in last 40 years, most infections which have come, 70% of them are zoonotic. You talk about HIV, you talk about SARS, you talk about bird flu, mad cow, or Nipah, Zika, everything, Mpox. All these are zoonotic And therefore, when you go into the depth of those diseases, that means human being picked up those infection, and then we are blaming the viruses.
Okay. Dr. Sulfi, the era of viruses, the mental health impact. Am I right in asking you whether people are now in today's time more psychologically vulnerable, especially after COVID-19?
Yeah, of course. People are definitely worried about, even now, even the people are worried about the COVID vaccination and the COVID after post-COVID symptoms and all.
Yeah.
So in a way, that's good. But then there is nothing to, like if you have, if you get more confused or maybe more anxious about trivial illnesses, that may not be good. And I think I'll advise the people, the public, we will take care of you. Don't worry. We will take care of the public health issue. If it becomes a public health issue, we will deal that, and there is nothing to worry at the moment. Just forget it. That is what I can say in a simple sentence.
Okay. We'll wrap this up. It seems like, there's nothing to worry or panic about. We can brush this under the rug unless something other happens, fingers crossed. You never know until it's actually tomorrow. Dr. Misra, the final word to you. From SARS to COVID to now Hantavirus scares, we're entering this era, the era of viruses, just like Mr. Gilada was pointing out, where rare infectious outbreaks, do you think they're going to become more frequent headlines and more frequent happenings in the days to come in our future?
See, new viruses, they are emerging, re-emerging, and because of many factors, yes, we might get many more infections, many more viruses in near future to come. And this is nothing new. I mean, if you see for last so many years, 40, 50 years, the viruses are coming, emerging and re-emerging. So I think viruses, they will keep on coming, and but challenges are always there.
Yep.
But we have very good public health system, and we'll take any challenge, and that's what I can say.
Okay,
For
all right.
Hantavirus,
So,
tagline is don't be panic.
all
Be
right. No,
informed.
we're going to stick to that. We're going to stick to that. The idea was not to strike fear in the minds and, and hearts of the viewers. For now, the WHO says that there is no reason for panic. We're going to stick to that. But in a world that is shaped by the scars of COVID-19, it's anybody's guess, and the mental trauma still exists. Every outbreak is no longer just a medical story. It's a test of our trust. It's a test of our preparedness and of our global vigilance. Let's hope that good sense prevails. Dr. Gilada, Dr. Sulfi, and Dr. Misra, many thanks for taking out the time and helping the viewers, bringing them up to speed as to what's really happening on the global front. So no need to worry, but we can all hope that good sense prevails. That's all the time we have for you in this edition of In Your Interest. We're going to catch you again next week. Many thanks for watching.
With AI-powered systems like the DSU AI Factory, threats can be detected and countered in real time, protecting lives. Artificial intelligence is transforming industry and shaping the future. Behind every breakthrough lies one essential force: compute power. Dayananda Sagar University, we are building a next-generation AI ecosystem where powerful infrastructure meets bold ideas, shaping tomorrow.